Well, after that great content of sports, bringing to you the latest update, what a way for us to transition and give you more. As far as we're related here, you can always add many of the related things you see on the road because of the campaign we've been waging the last 6 weeks related to road safety, tagged Arrive Alive with the same name as the hashtag Arrive Alive, and also the hashtag AM Show and the hashtag JoyNews on our relevant social media platforms. And we're talking on Twitter, JoyNews on TV, JoyNews on TV, which is our page on Facebook. And look, that will do us a lot of good. But moving on, we also do know that we have to treat many other related things. We're talking coronavirus, we're talking issues about our preparations, etc. But before we move on to all these conversations, a wise man once said, aging is not lost youth, but a new stage of opportunity and strength. This is our story. Get ready to celebrate with us. It is coming. What does age mean to you? Great question. To some, it is just a number. For some and for us, it's simply the number of years the world has enjoyed us. Get ready to celebrate with us. It is coming. And this is from the Graphic Group Communications. Well, moving on, we have to look at the relevant conversation on coronavirus. And, let me just introduce my guest in the studio, but also we'll be taking some insights from the Health Minister, Kwekwajiman Menu. We'll get to look at compilations of the stories relating to the president, not only coming through after his travel through the port of entry, but also going through the various health institutions that have been earmarked or set aside to make sure that they do the testing, which they've been doing. And, you know, that's a stage of approval that's been coming from the President, Dankwa Akufo-Addo. But we would also speak to the chairman of Parliamentary Health Committee. But let me just introduce Isaac Kampoma. He is the CEO of Concerned Health Education Ghana and Greater Accra Regional Secretary for the Coalition of NGOs in Health. Good morning to you.
Yeah, thank you.
Yes,
very
much.
And
and you've been observing so far the comments and the assurances from the Ministry of Health, but more so the Ghana Health Service. You've been looking at the media content, broadcast, and also publications. What would be your summary observation about how ready or not we are in relation to the coronavirus infections?
Right, thank you very much, and of course thank you to your cherished listeners. Indeed, coronavirus has become a global issue, and maybe as a country, Ghana is doing its best. I will put our preparedness in 4 stages. What is the political readiness as a country? And also, how prepared are we economically and socially? When it comes to service delivery and case management, how prepared are we? And also, in the event of financial and human resource, how ready are we to contain, like they say, contain, prevent, and manage coronavirus? So the discussions can go around these lines.
Well, let's straight away also get on to the screens and also look at the Health Minister, what he's been saying. We'll make his insert ready for you. Just to give you a recap of what the position of government is, the Ghana Health Service and the related agencies. So we'll play the insert of the Ghana Health Service and also now the Minister of Health, Kwekwajiman Menu, during that interaction.
Port of entry staff have been sensitized on case detection and infection prevention and control, undertaken for the heads of the designated points of entry and all International Airport staff. A holding room has been identified at the Kotoka International Airport to be utilized to hold COVID-19 suspected cases. Training of port health staff from designated points of entry and all staff from Kotoka International Airport. For surveillance, Mr. Speaker, we have adapted and circulated COVID-19 case definition to regional and lower levels. We have also adopted a COVID-19 case investigation form, which is currently in use. National Rapid Response Team has been activated. The national level training for rapid response teams and other health workers on severe acute respiratory illnesses has been done. Training of of regional and district rapid response teams have been planned for execution. The initial sensitization, including the private sector members, has been conducted. Mr. Speaker, 40 suspected coronavirus cases have been reported and tested. All these 40 cases have tested negative for COVID-19 from Noguchi Memorial Institute for Medical Research and Kumasi Center for Collaborative Research. And Mr. Speaker, I want to reiterate the fact that as yet, we have not found any Kenyan that has contracted this disease, either in country or even outside the country. Mr. Speaker, procurement of more reagents and primers for confirmation of coronavirus cases is actually ongoing to support the two big research centers. The Ministry of Health continues to work with the development partners to monitor the situation and further strengthen systems to prevent the introduction of the outbreak in Ghana and early detect and contain it if it should occur. In conclusion, Mr. Speaker, I wish to indicate that the government of Ghana is doing everything possible to prevent and protect against the outbreak and spread of the infection in Ghana. This is being done in collaboration with our development partners.
The country's preparedness to deal with any possible outbreak of the coronavirus was put to test today when President Akufo-Addo tested facilities here at the Kotoka International Airport. Indeed, through the thermal scanning to immigration officers handling people who are coming into the country, everything appears to be in order as far as Ghana's preparedness is concerned. Indeed, President Akufo-Addo, who came to Ghana yesterday after touring some European countries, subjected himself to the thermal scan, and he came out successful.
To make sure that we don't get people bumped together is to sometimes delay flights. So a flight may land and we may hold them. And we use the health ministry to achieve that because
so that you can evacuate the before another flight.
So there was an issue this morning where we had to delay a flight 30 minutes and they were complaining, but we told them that we have to do it for the sake of the industry, and so they complied.
Safety before everything else.
We've been speaking to the man who manages the Ghana Airport company, and he tells us that so far they have recorded 2 individuals who came in with signs and symptoms of the coronavirus. These individuals, according to him, were quarantined here at the airport and later taken to the Rich Hospital where they were monitored. He tells us that the tests after taking through samples and taken to Noguchi came out negative.
We haven't recorded any incident, but we have gotten 2 threats. Threats in the sense that people show signs of having the virus, and so we're quarantining those people. We got our medical team to take samples of that person and tested it, but on both occasions, the test proved to be negative, so that people were allowed to go. And one of the measures that we put in place, per international standard, is to take the temperature of each passenger that enters the country. There's a normal human body temperature. When it goes above a certain range, that would be an indication that that person could carry the virus, because high temperature is one of the symptoms of the virus. So once somebody exhibits a higher temperature, that person is put in that quarantine. We pull the person from the airport environment most, and we put it into this facility that exists on the air side. So in that facility, further assessment is done. And if we feel like the person shows higher signs of having the disease, then we send the person, we transfer the person without bringing the person through the terminal building, but we take the person through the airside, through an ambulance. So that facility has a gate onto our airside where we have positioned an ambulance. So the ambulance, with the right clothed medical officers, will then transport this person to one of our coronavirus centers, be it Rich Hospital or Tema.
The Ghana Airport, which is a major port of entry for travelers coming into Ghana, is in perfect readiness to ensure that people who come in do not carry the virus, and indeed the country is safe from any outbreak of the coronavirus. From the Kotoka International Airport Terminal 3, Elton Brobe reporting for JoyNews.
And Elton Brobe giving us all the update. And that, in my perception or in my opinion, was supposed to be symbolic. But of course, you may have heard heard myself and Mama Osabwaji having an argument about whether the measures put in place gives enough confidence to everybody to say that, look, when we go to sleep, we should be assured, rest assured that all is well. I've also been joined by Mr. Mike Kwafu. He's a member of Occupy Ghana. They also, alongside the One Movement pressure group, have also issued a statement. Mr. Kwafu, One Ghana Movement. And thank you for joining me from Occupy Ghana.
Right.
And from where you are,
yes,
the observations you've made so far, would you say that the assurances being given by the health minister, the Ghana Health Service, are enough for all of us to say that, look, we've put this to bed?
Yeah. Well, thank you very much for having me on the show. I speak for Occupy Ghana. And yes and no. First, let me take the yes, because I want to think that if the minister himself comes out to say this and this and this is what we've done, I want to believe that they are doing due process and things are being put in place the way the claim is. The no will be my own perceptions from looking at the scenarios that are playing around all the world and the domestic realities. And I look at the media and I use that as my barometer. I don't see any agitation. Maybe we don't want to agitate some kind of public panic or anything, but I would have thought that by now media would be into education and awareness strongly, you know, overwhelmingly, if I can put it like that. Because if you look at the kind of measures that were put on the ground in China, where of course it was incubated and they are dealing with very serious numbers, you get the impression that they, like we say in our local parlance, they are not leaving anything lying low. That's what they say in Nigeria, you know. So we cannot compare to China, obviously, when we are looking at logistics. But what is happening is that we want to look here and not just be dealing with broad statements, because I don't know if you have spoken to the medical groups, but when I take a look at the trip, for example, that the president had, what I see is that there's a certain formal setup. You know, it's already been announced that Rich Hospital is going to be one of the points of resolution and so on. A couple of places. I think Kolebu.
Yes, we have, apart from Rich, some 17 other places. Kolebu initially was not on, but then they were roped in.
Yes. But then I am looking at the broader picture of a situation where people are not primed for going towards these 17 places and do random visits to.
So you're saying that from the perspective of the ordinary man,
yes,
the awareness and the sense of readiness is not there.
Yeah, I don't feel it. And it's not just the feeling, it is the fact that if you speculate, can we say assuredly that every pharmacy and every hospital, private and otherwise, is primed to understand what this thing really is? Because you see, we cannot go with formal figures, you know, and look at the paperwork. All things being equal, you expect that the plans you've drawn should pan out. But there are a lot of incidentals. There's fundamentally the problem of education and what people are supposed to do in the event that they think that they have a fever. You get it. Which numbers are they supposed to contact? Where can they not go? Has it been made clear, for example, that if you suspect that you have COVID-19, you should make a call rather than step out and go and look for medication?
So it means that you form the same view as my co-host, Mama Osabwaji, that sense of awareness doesn't seem to be there. It's and she says that, for example, the media is the one going to people in authority.
Yes.
And it's not as if that those who have been put in those positions of authority rather are coming in to say, look, these are the measures based on the structures and then messaging to get everybody to come along.
That's a very strong position to come from. And I think I can subscribe to that. Because bottom line is that if there are any engagements, take this like a normal siege on the country by forces on the ground.
As in clear and present danger situation.
Proper war. Let's say there's a war.
Are we in that situation, a clear and present day?
Well, the threat is global, isn't it?
It is.
The threat is global. Now what we are doing is that we're doing numbers games. We're counting, 2 cases have appeared here. 2. I seem to feel, can I say that? But I get the impression that in our part of the world, particularly Ghana, we seem to be running on luck because we've had other incidences. Ebola has come and gone. We had swine flu. We did pretty well with H1N1 and so on. These are things that will continue to happen. We'll always continue to have epidemics. The fact that we have not confidently declared it as a pandemic should not make us feel laid back and lethargic. The initiative should come from the agencies that are supposed to be responsible for this, because we are unawares. So like any battle situation, in a war situation, the civilian populations don't know anything. It is the military that stands out there and puts things in place. Surveillance, protection, all that. So we are saying that there should be a holistic engagement with our publics. So whatever plans have been done, we should be privy to them. This is not time to mystify anything. We should just put it out there like it is, because people are reading about it in any case. If you go on the internet, you are well informed about how the scourge is moving around. You get it. So we cannot afford the silence. It is important. By now, we should have billboards, if anything, that have simple statements on them. Well, I'm a multimedia person. You know,
you're a Macom person, marketing communication
exactly.
person.
Stating exactly what we're dealing with. Simple statements. We know that people are being told about, you know, hygiene and things, but there are issues of attitude and habits. We need to deal with all these things, you know, because fundamentally it is not just the virus coming in. It is rather more preparedness in the individuals. So on a first level, you're looking at a scenario where, fine, we put the medics on the ground. How much training have they received all around? We don't know that, and so on. But if the minister is saying that we are ready, I want to believe that we are. But let's move from there and go to other scenarios.
Okay. Yes. We've also been joined on the line by Dr. Chum Nyama. He is the chairman of Parliament's Health Committee. But, you know, the good thing about him joining us for this conversation is that he's also a practitioner. He's a medical person. So he's a medical doctor. So it puts all the related conversations. And Dr. Chum Nyama, thank you for joining us.
Thank you for having me. Good morning to your viewers.
Yeah, good morning to you as well. And from your perspective, if you have to do a summary, would you say that from all the information you have, you can say you're confident we're ready?
Thank you very much. From the perspective of the Committee on Health in Parliament, we have had discussions especially with the Ministry of Health and the professionals at the Public Health Unit in Ghana Health Services. They briefed the committee on the level of preparedness they have put in place, logistics, training for the staff, you know, insurance cover for the frontline workers and all that. It was really a hectic discussion, and we were satisfied with the steps that they have put and what they want to put in place. And so we are monitoring the situation to see if there's the need to speak to some of the issues and all that. I think where we had a bit of reservation at the committee was in terms of monetary funds being made available for the agencies involved. We are monitoring that. We know that it is not possible to get all the funding immediately. We are happy that yesterday the Minister for Health came to Parliament to brief the House again, and then he mentioned that
there is the scare of a panic situation, and so you are not very forthcoming with the kind of engagements that will prepare the people. Then that also poses another danger, you know. So we need to do a certain balancing act. So we understand. I think that what we ought to be doing by now is to set agenda. And you rightly said it. Government should engage media to set the agenda. And let's let the professionals, because on this side of all this engagement is also other kinds of professionals who know what it takes to communicate messages. So engage the media, get them to come up with packages that will send the information out there without agitating anyone, so that we have an environment where people are in a state of preparedness. I'll give you an interesting illustration. I saw this thing somewhere else in another country where a prime minister or so was giving a message about how you shouldn't touch your face and so on. And then when she finishes, she does this. Okay? Now, just yesterday, I was watching somebody counting currency. And she was doing this. And then she will count.
That's the habits and attitudes I'm talking about. So we can do all the professional things of making sure that all the infrastructure and logistics are in place. But people and the way they will respond to the environment we have created is crucial. It's still a people thing. And so whether or not it is well received and well communicated and well acted upon will still depend on information and education, by and large. So it's important for us that we look at all the 7 pointers that Occupy Ghana came up with and be able to factor that into the kind of shoring up that we need to do with our listening publics. Because bottom line is going to be communication and how we communicate it. But where is the substance to communicate? There should be packages that are already prepared that speak to the issues that are easy to transmit, as in people will find it easy to receive at every level. I think we've concentrated a lot on urban centers, and it stands to reason because that's where you have a lot of billion around and so on. But our people and their habits, I'm not decrying anything, but we must go to our funerals on weekends. You know, we must shake hands, we must do this and that. Thank God, so far, it's not complacency, but the thing has not arrived on our shores. But we want to make sure that it does not. It may enter, but we'll say that it is not welcome.
For example, and I know that you've categorized your delivery into service delivery and all that. That's the perspective. So until you interact with the Ghana Health Service, for example, Ms. Ampoma, you will not get to know that, oh, we've had maybe 17 cases suspectedly, all testing negative, or 30 or 31, etc. But that should be information that should be coming, not thinking that we're creating panic. In what form should we have been communicating that to the ordinary person, to the health worker, and then the allied service providers?
Very good. So this is what we call integrated service delivery.
What?
Integrated service delivery. The already ongoing activities, all what you need to do is to send a communication that everybody should communicate about coronavirus prevention.
As in just to plug in.
Exactly. What we call how to maintain, how to prevent, and also how to manage. Yep. So these communication has to go on alongside with a very solid communication message moving along, all right? So if you look at even the health system itself, it has its own constraints with the diseases. TB has its constraint, malaria has its constraint, and also other disease areas has its constraint. So what we can also look at is what is the cost factor in terms of testing kits, right? Are we ready? What do we need in the event of, because then if you are going to test, then you need a whole new testing kits, you need human resource, you need personnel. What is the motivation? What is the incentive packages? Sometimes we know the attitude of health workers at our various hospitals. Some are very good, others are also not good. So these research and studies needs to come up so that in formulating some kind of an engagement and a message, we are informed of the past and get prepared for the future. So to me, I think it is time we engage everybody, both the media, civil society, and also the religious communities, because this is a human-to-human thing. All right, there is already a hand-washing campaign ongoing. We need to still intensify. Currently, they are even prioritizing funds to address issues. So there are global funds that are being prioritized to address some of these emerging issues. So it's a collective thing, and we all need hands on deck to address it.
If I may just add, I think Dr. Chum gives me a lot of confidence in terms of how we rally around things.
He does?
Well, to some extent, because I think we can give ourselves a thumbs up, the way we kind of like rally around it. But it's just this emergency syndrome thing, once again, that's a problem. Because why, for example, did we dismantle all the infrastructure after we had the case of Ebola?
Suspected cases, they have all been tested and proven negative. So I think that by and large, things are in place. There will always be room for improvement, and I will hope that I will plead that we all, lower our level of pessimism, because as a country, we've had several outbreaks around the world, and Ghana has always been, doing what we need to.
Okay.
We got one here on our shore, H1N1 at Kumaka, and we all saw how the health professionals rose to the occasion, and they were able to curb this outbreak. It never even spread from the school to the surrounding, environment. And I believe from the literature, this coronavirus is not too different from H1N1 and SARS. So, our preparedness in those areas can easily be transferred to this one. For instance, we already have some of the structures in place before we decided to, scale up because it's new infection. So let us all be a bit calm. I believe that we are on course and there will be no, room for panic and, haste as far as this issue is concerned.
Dr. Chum Nyama and his Kumaka example. Now, on a scale of 1 to 10, 0 to 100 in percentages, how would you scale or rate our preparedness?
I'll be a bit because
you are running away.
Yes, I'll give us 65 to 70%.
65 to 70.
Yes.
That's an A, right?
65. Well, if you say so, because I believe so far we are on course, and there's very little, doubt in what is happening now. So I'll give it 65 to 70%.
Well, thank you very much. Dr. Kwabena Chum Nyama is the chairman, the Health Committee of Parliament. He's also, of course, a member of Parliament, and thank you for joining us for that discussion. We have to wrap up, but yes, your last comment, your concluding comment, and of course, it's not going to be the last time we'll be talking about this.
Well, we have to keep engaging ourselves, each other on this, because I believe that knowledge is power. And it's quite reassuring that at least somebody from the front line can give us all this confidence, But I really think that we need to be, let me just tell a little story. Years ago, there was a musician who did a song, and he was talking about a new disease that had come. He was talking about AIDS. And he was coming from an experience where this thing was real. When he was singing that song about AIDS, nobody understood it. For a long time, we were totally clueless about AIDS and HIV and so on, until it evidenced here, and we actually saw it for what it is. So we will not cause panic, but we will also not allow ourselves to be laid back in terms of being aware. So I am saying that with or without coronavirus, it's important that we take advantage of this and look at health education as something that is primary to the collective health of this nation, whichever way you look at it, because a healthy nation is a progressive one.
Yeah, I love that. Your concluding comment, just shortly in 30 seconds.
Very good. I think coronavirus is a global health issue, and of course Ghana should not see itself as immune. We should continue doing what we are doing. We should keep engaging, and we should also make sure that fund is available, and also engage civil society actors across the country, and also universities for studies, research, and some ideas, so we can all fight the disease.
Yeah, and we'll take you to CNN and conclude. Just over the last 5 minutes, Bosnia-Herzegovina just recording its first case, and they've reported that. You move up, you also get to find out the cases are now 25 in total. 6 more coronavirus cases recorded in Iceland. It's a very cold country. The individual diagnosed are Icelanders who recently had been traveling to Italy and Austria. We have a lot of migrants in Italy and in and out travelers, etc. Moving on also, you get all the latest update. And talking about where you can get all the latest update, myjoyonline.com is where you can. And our handles on Twitter at JoyNews on TV, and also a page on Facebook, JoyNews on TV, will give you all the best. Poland reports first case of coronavirus. We just numbering the tested cases suspectedly, all proving negative, number 40, as announced on Wednesday by Ghana's health minister. We'll keep you updated on the latest, but please know that assuredly where you can get all the best information, content-driven, impactful, is right here on JoyNews. In the meantime, we have to get a great information on how you and I can be great donors of blood with the National Blood Service. They are in for a next conversation. Stay with us.